The definition of a nurse is to go above and beyond the call of duty. The first to work and the last to leave, the heart and soul of caring, a unique soul who will pass through your life for a minute and impact it for an eternity, an empowered individual whom you may meet only for a 12-hour period, but who will put you and yours above theirs. Have you ever been to a hospital, a clinic, or a doctor's office before? Almost everyone has at least once in their life because of pain they are feeling, if they're sick, or because they need help. If you've been there, then you have definitely seen a nurse at work. Registered nurses work in all different areas and do so many different jobs to help people because they have a passion to help others. Right now, I am currently a nursing student at Spoon River College. I am learning all about the different jobs a nurse has, all the paperwork they have to do, and the millions of things they have to remember. And hopefully in 2 years, I will be able to say I'm a registered nurse. Registered nurses are so important because they have so many different things they have to take care of. So today I'm going to be talking about the elements of nursing, the qualifications a person needs to become a nurse, and why they are so important to have since they affect everyone around them. So first I'm going to be discussing the elements of nursing, which is discussing exactly what a registered nurse does. So according to registerednurse.org, a registered nurse's job description includes all of the following. They perform nursing vital visits within scope of practice and assist with developing group visits with manager and providers. They demonstrate appropriate knowledge and skills to coordinate and evaluate patient care. They work proactively as part of a team with physicians, professionals, and staff members, exhibits ethical practice with policies and procedures in nursing care at all times, is adept at integrating and enforcing regulatory requirements in relation to nursing, and is able to follow physicians' written orders and coordinate critical results in a timely manner, and possesses excellent communication. There are several more actions, but this was just a few that I named, and this evidence shows that my claim of why nurses are important is true because they take care of so many different things for other people. And next I'm going to be talking about a place that a registered nurse can work. So according to registerednurse.org, they can work in hospitals, nursing education departments, skilled nursing facilities, rehabilitation facilities, psychiatric facilities, state prisons, outpatient clinics, physician offices, aesthetic clinics, telephone triage, organ procurement coordinator, and as a travel nurse. This evidence shows that my claim of nurses being important is true because all of the different places that a registered nurse has to work and all the different people that they'll see. And then last, I'm going to be talking about all the jobs a registered nurse has. So registered nurses can administer and monitor medications. They insert, manage, and discontinue intravenous catheters and intraurethral catheters, develop a plan of care for each patient, proper assessment and management of all patient populations with appropriate interventions, take vital signs, recognize and address abnormalities, admit and discharge a patient safely and appropriately. They have to do accurate documentation, safe patient transfers in and out of bed, perform basic life support, wound care, feeding, dressing, and performing hygiene and ensuring patient safety. This evidence shows that my claim of nursing being very important is true because it shows that registered nurses have so many different jobs and that we need them to do those jobs because we wouldn't have anyone else. So next I'm going to be discussing the qualifications to becoming a nurse. So just the requirements to get into the program. According to study.com, just the courses you have to take are English, psychology, statistics, human anatomy and physiology, algebra, nutrition, and chemistry. And students can take all these courses while they are in the program or before they get into the program. And then you will also have to take a TEAS test and pass it to get into the program as well. And this evidence shows that my claim of nursing being very important is true because it shows that people need to have a good educational background to get into the program. And then next, the classes you will take while you're in the program to get your associate's degree. Students will take classes like pharmacology, management, nursing skills, and patient care. The degree when a person has finished the program would be an associate's degree, of Science in Nursing or Associate of Applied Science in Nursing, which will usually take 2 to 3 years to complete, depending on the program. And this evidence shows that my claim of nursing being very important is true because it shows that they take a lot of classes and have to put in a lot of hours to get the education they need to get their degree. And then to get the actual RN certification, a person will need to have learned their diploma, their associate's degree or bachelor's degree in nursing, and then pass the National Council Licensure Examination, which is the NCLEX, and they have to meet their state's requirements for the nursing licensure. So according to Anna Henrich, the NCLEX is a required exam for any prospective nurse, and it contains 75 to 265 questions that test all areas of nursing. And this evidence shows that my claim of nursing being very important is true because a nurse can't start practicing by themselves until they pass the NCLEX to know what they're doing. So now that was all the qualifications needed to be a registered nurse. So now I'm going to discuss the impacts that a nurse makes in daily lives. So according to Advent Health, registered nurses make an impact because they support your whole health. Nurses are there to support you on your journey to whole health, which includes listening to you, supporting you, and helping you connect you to the resources you may need. This evidence shows that my claim of nurses being very important is true because when someone is in care of a nurse, they need to be supported and taken care of to get better. And then also according to Advent Health, registered nurses make an impact because they support your family as well. Nurses make sure families are seen and heard, and they are also there to answer any questions or help you in the role as being a caregiver for a family member. And this evidence shows that my claim of nursing is important. It's true because nurses take into consideration their patients' families, which is very important to a lot of people, and that way the family knows what is going on and know that their family member is in good hands. Next, registered nurses make an impact because they use their experience to advocate for their patients and others. Nurses use their voice and experience to advocate for patients within their healthcare team, ensuring that they get the care that they need. Nurses also play a key role in shaping worldwide policies for approaches that help patients and their families. This evidence shows that my claim is true because nurses will make sure that their patient is getting the best care that they need and that they're being treated correctly. And then lastly, nurses make an impact because they're impacting care and changing lives. Nurses come into work every day with a unique opportunity to make a difference in our lives. They're deeply proud of that responsibility and are committed to find ways, both big and small, that will help us feel better. This evidence shows that my claim is true because nurses make such a huge impact on people's lives and could end up changing a person's life as well. In conclusion, you see that registered nurses are very important to have and we need them. Registered nurses have so many different jobs that they do and have to have the right education to know what they're doing and make an impact on people's lives. And they're so important because of all the different things that they take care of for others. And just remember to always be nice to your nurses because they have so much going on and just want to give you the best care possible.
Good job.
Oh, yeah.
All right, Dee.
Hold on, I got you.